Hi, and welcome to this week's The Right Way Wednesday. I'm Christy Yoski from the Clinical Strategies Division, and I'm bringing you this week's The Right Way Wednesday from vacation. We're going to talk a little bit about health literacy and Teachack as it relates to daily notes, progress notes, and billing. So we're going to talk a little bit about daily notes. And it's important to be as specific as possible when you're talking about the health literacy or education type that you're providing for one of two reasons. So that the reviewer who's reviewing your documentation knows and understands the type of education that you're providing, but also the treating clinician, if you're not the same clinician treating the next day, they can pick up and continue the education or health literacy that you've started the previous day. So I'm going to give you an example here of really the documentation we should see in those daily notes. Again, it's going to be more specific on what you've done. So the patient was able to teach back signs and symptoms of COPD or exacerbating factors of COPD with supervision and 50% verbal cues. So that to me, as the therapist or the reviewer, means that you've focused on the health literacy regarding those exacerbating factors. They were able to start to teach it back, but you still needed to cue them to do that. So as the next clinician, I'm going to continue that education with Teachack. And once they're able to teach it back, then I want to see them return demonstrate it in their mobility, IADLs, ADLs, depending on the education. Can they then use it in real life? And that will be important to document as well. And then maybe I'm going to focus on a little bit of diaphragmatic breathing. So I may say focus on diaphragmatic breathing techniques on this date, patient unable to teach back the steps of diaphragmatic breathing. So again, as the therapist who may be treating the next day, I can see that the patient is focused on diaphragmatic breathing, and then I know I need to focus on that education after that.
That's why I came out.
Yeah, so I have a little helper today named Eden on vacation. She's going to help me talk to you a little bit about progress notes. Say hi, Eden. She's eating as well. So the progress note should look very similar to the daily note, but you really want to highlight the education of the health literacy. You can do more of a broad overview, so talking about just health literacy related to COPD and breathing techniques, and that will get you what you need. I think we underestimate and
Why?
Well, because it's important, that's why. I think we underestimate what we do as clinicians, and we don't really give ourselves credit for enough of the education that we've provided. So in that progress note for...
Yeah,
Is it important?
tripping.
It's so important. So that's the progress note. It's very quick and easy, but just making sure that you're highlighting more of an overview of the health literacy. Teach back and return demonstration, same thing. Was the patient able to teach back? Where are you in the process, or could they return demonstrate within ADLs, IADLs, and gait training? Okay, and so the last thing we're going to talk about is billing today. And it's really important that you refer to your LCD or local coverage determination for the codes and what documentation is required. But for the most part, we're seeing... Hi, Eden's back. We're seeing occupational therapy.
I heard a donkey.
We heard a dog. We're seeing occupational therapy bill for self-care management for the most part for their health literacy, PT billing, therapeutic activity, and speech really depends on the education that you're providing. So it could be anywhere from the dysphagia code, the speech and hearing code, or again, the cognitive skills development code, but there has to be some sort of ability to restore function and progress made. But I think that one's most important, that you check your LCD as well. So that's pretty much it for health literacy, for daily notes, progress notes, and for billing. So that's it for this week's The Right Way Wednesday. Thanks for tuning in. Eden and I had so much fun filming this. Have a great rest of your week. Bye.